include things throughout history, specifically things that led up to this project's funding, as well as the movement, the domestic and sexual violence movements in general. And so if you click on the timeline tab, you'll see this beautiful graphic timeline that Montana created. And it starts off with some laws, so we have Public Law 280 back in 1953, and we were very intentional on what we included, and we know that there's a lot more, but we wanted to kind of pull out highlights throughout the years, and from there look at specific things that have happened in history and things that we talk about when we're looking at domestic violence in the Native American communities. And so if there's anything that you don't see here that you think should be here, please let us know, as well as anything that you want to add or you like, let us know too. But so we've included, different awareness days that have been adopted over the course of the years, both for domestic violence and sexual assault. In 1994, it's a big one because obviously with VAWA it becomes law. And it's really the first piece of legislation that concentrates at a federal level on, violence against women. And so that is extremely important, as well as the reauthorization of VAWA, but because that really shows the gap for urban natives. And that is the gap that this project, Red Women Rising, is one of its objectives is to attempt to fill some of that. VAWA allocated some funding and protections to tribal peoples, and again, natives within urban areas were not the focus and included very much in those. So Red Women Rising, again, is in an effort to not only fulfill part of that gap, but also advocate for further funding and to acknowledge that natives in urban areas have different needs and have a different experience. And so, again, in 2014, that's when Sakui had focused on recognizing that gap and attempting to seek funding and create Red Women Rising. So, over the last few years, once it was funded in 2015, that's when the first phase of the project was rolled out, which included a lot of the media, the animated vignette that was created, as well as posters and awareness, and the best practices guide that was created. And over the last couple of years, we've been doing many presentations and talking a lot about the best practices guide and how that can now be implemented. So in the last couple of years has been that phase 2 of this project, and we've been focusing a lot on implementation of that best practices guide, as well as launching this website, and that's where we're kind of at today, in addition to looking at how we can become more visible. So we've been presenting at statewide conferences, looking at many opportunities to present at agencies and other areas that we can create visibility for the project and continued awareness. We also created several digital stories that Montana will kind of show you where they're at on the website. But again, this timeline is something that we really wanted to include to give people a little bit of credit and history in terms of, Red Women Rising is something that was created in response to other things that have happened historically and has become a crucial part of the movement today.
Right. Thank you, Stephen A. That's excellent. Right. So like a lot of, the timeline, as you can see, Sakui doesn't come in until around 2014. But with the timeline, we really wanted to highlight, a lot of the work that was done in the previous decades that even allowed, our organization to begin working in this narrow scope, of addressing violence against, Native women in urban areas. But a lot of that is owed to the fact that the foundation of the general, work of, domestic violence policy in this country was put there in the first place. And so this work is possible by all of the events and even more than what was even included in the timeline that came before we even entered into this work. And, moving forward, off that work, so some of the So this website also includes so for interested parties, statistics for being awareness and light to the issue of like how prevalent violence against women, Native women is. And so from the first phase of Red Women Rising, we developed in collaboration with an artist, Sarah Viscara Dilley. We developed several of these graphics that we use in order to convey the gravity and the weight of this issue. Because it's not an issue that a lot of people have like a lot of awareness and knowledge about. And so this website includes these, and are available for download and upon request, as well as physical materials. The ability to take these images and share them with individuals in order to basically spread awareness about this issue, so that it can be addressed on an even wider level, right? And so, because we understand the importance of educating around this issue, as well as creating, access to services for the women who experience it. So, and moving towards, this is a number, so these are a lot of the print and static materials. But if you move to the bottom of the Stats on DV page and click on the link to hear stories of survivors and the history of domestic violence in Native communities, then we have a page where we've compiled all the digital media. And so this is where the Ingenuity vignette that was produced as a part of the first phase of RAR lives, which is basically discussing the history, the context, colonization that resulted in a lot of the trauma that has manifested in domestic violence and sexual assault against this community. And moving further down the page, we also have compiled the digital stories that have been created directly for this project by different survivors in California who have told their stories, their history with domestic violence. As a way of raising awareness and providing empowering narratives for women who may also need to hear these stories in order to make progress in their path, to healing.
Montana, are we able to at least hear one of maybe the Reflections of Me digital story?
Yeah.
Because that's more of a poem. I think that even those that can't see it on video can hear it.
Yeah, sure. Let me pull it up. So it should be audible. Yeah, so I don't.
We can't. Yeah.
Yeah, I don't think it's audible.
That's okay.
Yeah. It's all right. So I do think I hear some feedback in the background. Let's see. Real quick. All right. Okay, got it. All right. So moving forward, so this is just another component of the website for sharing, different digital stories as a part of the work that's been done in the previous phase of Red Women Rising, and as a part of this phase as well. So let's see. So and so one of the core purposes of this website is of course to link survivors to services. So if you click on the tab at the top of the page for survivors and service seekers, and you move into the left column, the service directory, and click on that, you have another large component for what the website actually is one of its primary purposes. And so you scroll down the page and you see this California color-coded, different regions, each labeled. And to the right of that, you see these different buttons, from national, statewide, and then the different regions that are on the map. And so survivors, so what we really wanted to do, and what Destiny and Stephen A. really put a lot of work into, was compiling resources, trying to be as comprehensive as possible for, every region of California, where survivors could potentially access resources. And so clicking on any of the buttons will bring you down to that area, that region inside the directory, and then they're able to scroll in order to access, what is inside of each of these areas, all the resources that we've been able to compile. And so you'll have the name of the resource with a link to their website, a brief description, so someone can look to see if that is if they provide service, the type of service that they're looking for, whether it be a shelter, whether it be legal services, family services, child services, housing, and more. As well as 1 to 3 different phone lines for that service, since many of them provide a 24-hour crisis hotline, or just have direct line or have office lines. And then and below that, you'll also see the county. So a person can sort through the different services available to find one that is nearest to where they are. And so we really wanted to and so inside of this page, I think there are about 125 or so resources, and that list is still growing because we're trying to make sure that at least every county have resources inside of it to provide as much, comprehensive access to survivors inside the state of California as possible. And so moving through, you just see so from the top of the state to the bottom of the state, we have resources for each one, including the different national and statewide resources, most of which, are either hotlines or advocacy organizations, but are also doing work that survivor may want to be, or anyone else, who's working inside this field may want to be aware of in order to get in contact, build relationships, perhaps with their agencies. And so moving back to the top of this page. So if you click back on the service seekers and survivors link at the top, and click on domestic violence and sexual assault resources on the right-hand column, you can see some of the resources that we've compiled that are targeted at survivors. So this page really has information documents that are tied to provide building a survivor's capacity to address their own situation, perhaps helping them seek help. So, and as well as, so for instance, we have the first document on the page is safety planning for survivors, which is aimed at helping survivors be able to think materially about how, if they once they've decided that they want to exit a situation or want to that thought is entered into their heads, they want to get out. This provides a list of, a checklist essentially of the different ways that could be accomplished. So we wanted to provide, things that would give survivors the means to basically have agency inside their situations in order to move through them. And so this is just one of them that, Stephen and Jesse helped curate so that we could put it on the website. And we're also really receptive to feedback and for different types of resources, because we know this is far from comprehensive, and we've already seen feedback in the past that different other types of resources that we could include, and so we really are we want to make this as responsive and as useful a tool as possible. So any suggestions for additional resources, whether they be aimed at the survivors or providers, or focus on different policies, or in the legal realm, if we can include them on the website to make it a more accessible and responsive tool, then we happily welcome them. And so that's the general purpose of this page. And if we move back to the top, we have, if you click on the For Organizations and Providers link, we have 2 pages, so provider resources and peer network webinar trainings. So if you click on the left-hand column for provider resources, then you see a similar page to what we just viewed, where it's resources that are compiled that are targeted at providers and organizations. And so some of these are tools that are aimed at building direct capacity for providers interacting with Native patients. Other ones are aimed at organizations, strategies for enhancing their relationships with, if if an agency or clinic itself does not have its own built-in domestic violence responsive services, then there is a tool, this best practices guide, and other documents that are discussing, how relationships with the local domestic violence agencies can be formed and how it's functioned. Specifically in the case of Sacramento Native American Health Center and Weave in Sacramento, and how that can be applied to other organizations to form working relationships to link survivors to care, to services. And so additionally, there are tools that survivors can use if a provider does not regularly work, with Native patients or does not work in a Native setting, then there are tools that can be used by providers to facilitate that working relationship, to make it easier for them to be able to interact, in a culturally responsive way, without necessarily having the background. And so we really want, competency to be raised, because not every survivor is going to have access to a Native serving organization. And in the event that they go somewhere else, then it's beneficial for providers to have access to tools that still ensure that person gets the type of responsive care that they need. So you can go through the list of the different resources that we've compiled here, and if something stands out to you that is lacking, that you can think of a resource that we don't have here, then we happily, we want to hear about that, so we can get it on there as soon as possible, so that we can continue to build, this library of potential resources. And at the bottom of this page, so if you move down to domestic violence peer network calls and click on the button that says listen to recordings, then you move into what we're doing right now, which is the peer network webinars. So essentially, this is just where the recordings for these calls go. As a part of the Revenue Rising Project, a series of about 7 or 8 calls, has been planned. Each call, addressing a specific topic. For delivery of domestic violence and sexual assault services for Native patients. This would be the 6th call. So after this one finishes, then it will go up on the website as well. But you're able to do the previous 5 calls by clicking on the links above, and it will link you to an audio recording of that call. If there's a topic that and these can be used for training purposes. They can be used for individual learning. But they're here as a resource as well, to provide a more and to increase the comprehensive nature of the website. And at the bottom of this page, we have links to additional webinar trainings provided by the National Indigenous Women's Resource Center, since they have also compiled a pretty robust library of webinars that address not just direct service for domestic violence professionals, but also organizational capacity building, skill building, and things of that nature. So it's also pretty comprehensive and a really good resource to have available. And we're doing our best to work in the other links to other like clearinghouses or resource libraries for other Native serving organizations in order to make this website even more of like a place to go, so you can find whatever kind of information you need, even if it's not directly contained on the website. And so any feedback as to what other resources would be useful to link to are also very welcome. And lastly, we have our partners page. So Succeed has been involved, over the course of these past few years with a number of partners in, affecting, the mission of the Revenue Rising Project. And so this page, has the list of, those organizations who we've worked with, who have either we've collaborated with, or, who have been the recipients of, some of the work, some of the products of BRAR, and people that we're just grateful for. And so the project is something that we invite, we want as many partners and agencies and organizations to work with so that the work can continue beyond, the grant cycle, so that the work can continue to live on inside the network of relationships that has been, established, by this project and the mission that it's trying to accomplish. So that's essentially the website and what's contained on it. And I know that was a quick way to go through it, but it's I don't want to get too much time talking about the website when you can see it for yourself and kind of take it in at your own pace and navigate it. But one last piece, so that we are also interested in getting feedback on, is linking survivors to traditional healing. And so this is still a work in progress. Our team has been reaching out to community and planning internally in order to find a way to make this section what we want it to be, in order to basically make sure that this is a part of the cultural responsive objective of the website, ensuring that survivors who do want to turn to traditional modalities of healing, that this website can in some way facilitate that. And Stephen A. or Jesse, do you want to talk about the work being done for this?
Yes, so this is, again, as Montana mentioned, this is one area that we wanted to definitely include with the launch of the website as a part of it, but it is very much in a continued process of development. And when we presented this last Wednesday here in Sacramento to a group of Native folks, we did get some good feedback on other things to include. But what we mostly, we wanted to be very transparent and acknowledge that this is a sensitive area for those of us that are Native and those of us that understand the importance of including cultural and spiritual practices in our healing, in the healing of our communities and families. And at the same time, we have to be very careful, and it's controversial. So we want to make sure that we are, A, being very transparent, and two, being respectful, and then three, making sure that we are providing that as an option to those who want it. And again, the actual process at this moment is that they submit that kind of information request to SACUI, and then from there, a further assessment and conversation about, what they're really looking for, what their needs are, what area they are in, and all of that to kind of point them in the right direction. And a lot of times that might just mean a referral to their local Urban Indian Health Center or another agency that is culturally responsive and has services that may meet their needs. We have other things that I think we're going to be adding in terms of just meditation and things, but we also want to be careful that we're not pointing someone in the direction that they don't want to go, or we want to make sure that it is survivor driven, and we want to make sure that we are referring them to appropriate people. So that is kind of where we're looking for feedback on healers in different communities, as well as recommendations for how this process can be smoother. And so we're definitely open to suggestions and conversation about that. We've had some really good feedback in terms of why this is important, and a lot of it points to, again, why historically we don't have access to these things. And one side of it is that, yes, we want to promote other types of intervention and healing, but we also know that historically these things have been deprived of us, and we want funders to acknowledge that these are, in fact, best practices for our community, and that means that we should have access to them. And so that's kind of like the background of it, and we are, like we said, just very much looking for recommendations and conversation on this, because we want to make sure that it is something that people are comfortable with. We want to make sure that it is appropriate, and so for the time being, we're using this screening form to kind of just as a first step, and then from there, We have people that are trained and have knowledge of how to do this appropriately, but we are not um, doing a direct referral from the website at this time.
When are you taking feedback, Siboney?
Well, after this call, I'm going to email everyone on the call a link to a SurveyMonkey, and Montana created a list of questions, and you'll be able to kind of type that right in and send it, and on that form you can include any feedback, but you can also do a direct call with me or email. Any of that is completely fine.
Okay. Yeah, I have some suggestions for the traditional healing.
Excellent. Thank you.
All right. So that is essentially the entirety of the redwindrising.org as it stands right now. It's still technically a work in progress. Things are still being added to it and it's being updated. But in terms of the substance and what's provided on it, we've covered it. So I'm going to stop my screen share.
So at this time, if anyone has any questions or even suggestions, like with that quick review of the website, is there something that you obviously don't see there that you would like to see? Or again, any questions? This is definitely a time to get some insight from Montana. He's the mastermind behind all of this creation, or Jesse and I in terms of content. Right now is a good time for that.
This is Janet. I really like that you can click on one of the things and get some of the prior trainings. I mean, I can see us using. We have a cultural seminar once a week here at Native American Health Center for our clinicians, and it'd be really nice to just click on one of those links to provide a training. And I'm really glad that some of the trainings are on male survivors and people that harm, because I know people are wanting to see this not just as how to heal the victim of domestic violence, but as the perpetrators of domestic violence. What is their psychology and how can we be helpful so we don't unknowingly and unconsciously nurture another generation of people that are going to harm and be perpetrators. So I think that information, I'm glad you're taking on the challenge to look at that angle of violence as well.
Thank you so much for that feedback, Janet. It's good to hear that those trainings can be utilized in that way, because that was one of the intentions that we were thinking. And it's hard to get staff sometimes even all together. So even in smaller department meetings or even individually, for new staff upon their hire, they can be directed to review those trainings on the website. So I'm glad to hear that you are looking forward to using those in that way. The other piece that I heard from you is again that feedback in terms of using the website and stuff. So thank you.
This might be a long-term goal, not so much related to the website, but for traditional healing, any kind of teaching about the cultural value of women in our traditional tribal societies, I think, is part of traditional healing. I mean, women feel very, very nourished and empowered when they realize, oh, what's happening to me is just a colonizer's cultural values being used to harm me. And I think it's very healing for women and girls to hear what is their cultural value in our tribal communities. And I think especially for the girls, to try to prevent violence from happening. If they know their worth, then we can avoid a lot of violence. So I think that would fall into traditional healing, just to have on the traditional roles and traditional values of women, and even sponsoring coming of age ceremonies, for both girls and boys, because that's where you learn those teachings. So I mean, I don't see the traditional healing just being a traditional healer for one person.
Right.
Teaching these cultural norms, larger public, so we can prevent,
Right.
domestic violence from, affecting the next generation.
Absolutely. Thank you for pointing that out because we definitely see it from that perspective in terms of healing communities as well as prevention and maintenance, right? And so all of those pieces are very important. And so, giving people access to that traditional piece is definitely what we're looking at as well. So thank you for that suggestion. And I will also, in addition to that survey in the email, I will also be sending out an email shortly seeking additional topics for not only these peer network calls, but also for potential, videos, digital stories, or trainings, because we want feedback. This is what the fifth or sixth call for this year, and we want to make sure that we are responding to what you guys are asking for. So look out for that email later on today as well. And so I'll add that to the list, Janet, and then any others that you have, we're happy to hear. Does anybody else have any questions?
No, we're good. I'm good.
Okay. So we're going to ask that, again, maybe you guys take a little bit of time outside of this call to navigate that website. We really want it to be user-friendly. We want it to have and include everything that you need. So we also ask that, maybe get other colleagues, if you have access to any survivors even that want to navigate it and then give us feedback. Feel free to share that SurveyMonkey link, and or they can contact us directly if they'd like also. But that would be really helpful for us in order to make sure that the website is as comprehensive as possible. Okay, Montana, do you have anything else to add before we close the call?
No. I'd just appreciate you guys filling out the SurveyMonkey that's going to follow up this call, so we can get that feedback and incorporate it as soon as possible to the website to keep on improving it.
Okay. With that, I just want to do a closing blessing real briefly. I want to thank the Creator for this day. Thank you all who joined. Thank you to all who do this work. I want to thank Creator for strength and for continued vision, and thank Creator for all the blessings and the intent behind everything that we do. With that, I want to wish you all a beautiful day and weekend, and I hope that you continue to be engaged and have impact in your community. On my relations. So thank you, everyone, and look out for an email also about the next call for next month. All right, everyone, have a great weekend.
Thank
you.
Thank you.
Bye-bye.
Bye.
Thank you.
Montana, did you want to check in real quick?
Let me pause this recording.
That's what I was thinking.